be your nurse today. Can I just confirm your name and date of birth for me, please?
Emily Brown, 5806.
All right, excellent. Today I'm going to be doing a physical assessment. It should take no more than 15 minutes. Do you have any allergies?
Nope.
All right. And are you in any pain today?
No.
All right, excellent. Looking at my general survey, the patient appears to be happy and content. Her posture is straight and upright. The patient shows no signs of acute distress or discomfort, and there are no signs of physical deformities. Okay, now moving forward to the skin and nails assessment. Is it okay if I touch your forehead and your hands?
Yeah.
Okay. All right. Patient's skin is warm, smooth, and dry. No visible wounds. And can I just see your nails, please? All right. Patient's nails are round, smooth, untextured, and there are no signs of clubbing. All right. Now moving forward to nose, mouth, and throat assessment. All right. Do you have any issues with nasal drainage?
No.
All right. The patient denies nasal drainage. And can I just have you take one finger and press into one side of your nose and breathe in? Okay. And do the same on the other. All right. Patient's air movement is smooth and nares are patent bilaterally. All right. Now can I just have you open your mouth, please? All right. Patient's gums and oral mucosa are pink and moist. Tongue is midline and teeth are intact. Patient's mouth or lips are also pink and moist with no cracking noted. Can I just have you lift up your head for me? And it's okay if I palpate your neck? Okay. All right. Trachea is midline and no signs of deviations. All right, now moving forward to musculoskeletal. Can I just have you sit up without using your hands? So lift up your hands for me. Okay, thank you. All right, now from this end of the wall, walk towards the windows and then walk back. All right, I'm looking at the patient's gait and it is smooth, steady, and well balanced. Now, can I just have you sit down for me, please? Okay. And can you just squeeze my hands? All right, excellent. And then push up against my hands. All right, and can I just have you lift up? Okay, push down. Okay. Patient's hands and feet are strong and with equal strength bilaterally. Now doing the neurological assessment. Again, can you just tell me your name and date of birth?
Emily Brown, 5806.
Okay. And can I just ask you what day it is?
Tuesday.
All right. And can you tell me where we are right now?
The clinic.
All right. And can you tell me why we're here?
Just an annual checkup.
All right. The patient is alert and oriented, ×4. Now I'm just gonna assess your eyes. All right, can you just look at the center of my face here? All right. All right. Patient's pupils are round, equal, and reactive to light, and they are accommodating. Can you also just here look at my pen, and then look at the wall, and look at my pen, and look at the wall. All right. Next, I'm just gonna assess your hearing, and can you close your eyes and then tell me which side you hear a noise on?
The left. Right. Right. Both.
All right, excellent. Patient's hearing is within normal limits with no assistive devices needed. Now I am gonna perform the respiratory assessment. Can I just have you stand up for me, please? Okay. looking at the patient's anterolateral ratio is 2 to 1, and patient has no signs of barrel chest. Can I have you sit on the edge of the seat, please? Now I am going to auscultate your breathing. Okay. All right. Take a deep breath every time I move here. Okay. Now I'm just going to listen to the side. Alright, now can you just move towards the side here a little bit? Thank you. Just move your hair. Alright, now I'm just going to listen to your back here. Patient's breath sounds, are negative for adventitious sounds. There are no signs of crackling, wheezing, or rhonchi. All lung bases are clear. All right, now moving forward to the cardiac assessment. Again, I am going to take a listen to your chest, specifically your heart. Okay. All right. First, I'm listening to the aortic valve. Okay. Next, the pulmonic. Okay. Next, Erb's point. Next, the tricuspid. And next, the mitral. And then in a clinical setting, I would take the apical pulse here as well for a full minute, but for the sake of this head to toe assessment, I will only listen to it for a few seconds. All right. Patient's heart has no signs, has no sounds of any abnormal heartbeats or arrhythmias. Okay, next I'm just gonna, can I have your hands like this for me, please? And I'm just gonna check your radial pulses. Patient's radial pulses are palpable and strong bilaterally. And now I'm gonna check your capillary refill. All right, patient's capillary refill for hands are less than 2 seconds, indicating adequate perfusion. All right, now I'm just gonna check your pedal pulses. All right, patient's pedal pulses are palpable and strong bilaterally. Now I'm just gonna check the capillary refill on your toes. Patient's toes capillary refill are less than 2 seconds, indicating adequate perfusion. Okay, now moving on to the gastrointestinal assessment. Can I have you lay down on your back, please? Okay. And today, do you have any abdominal pains?
Nope.
Okay. And when was the last time you urinated?
2 hours ago.
Okay. And when was your last bowel movement?
About 6 hours ago.
Okay. Looking at the patient's abdomen, it is flat and smooth. And now I'm just gonna listen to your bowel movements. bowel movements are active. And is it okay if I just palpate your abdomen? Okay. Here. Patient's abdomen is palpable with no feelings of obstructions or tenderness. And now, in the clinical setting, after all of my assessments, I would put the two sides, the guardrails to the two sides of the bed up, and then I would adjust the bed to a low and locked position. And then, is there anything else I could get for you today?
Nope.
Okay. And in a clinical setting, I would also have the call light placed right next to the patient. And if you need me, the call light is right there for you. And now I would perform hand hygiene.